Can this investigational medicine for obesity and type 2 diabetes cause dizziness? Dizziness has been reported as an adverse event in retatrutide clinical trials, though it occurs less frequently than gastrointestinal side effects such as nausea. So, can retatrutide cause dizziness? Yes, clinical trial data suggest it can, though it appears less commonly than side effects like nausea or vomiting. Retatrutide is still an investigational medicine. It hasn't yet been approved by the MHRA here in the UK, so its full safety profile is still being established through ongoing trials. That context matters because it shapes everything we currently know and don't yet know about how it affects people. What is retatrutide exactly? It's a triple hormone receptor agonist, meaning it acts on 3 receptors simultaneously: GLP-1, GIP, and glucagon. That sets it apart from currently approved medicines like semaglutide or tirzepatide, which target fewer receptors. It's being investigated primarily for obesity and type 2 diabetes. Now back to dizziness. A phase 2 trial published in the New England Journal of Medicine in 2023 did record dizziness as an adverse event among some participants. But to be clear, it wasn't among the most frequently reported side effects. Gastrointestinal symptoms like nausea and vomiting were more common. Why might dizziness occur? There are a few possible mechanisms. Retatrutide suppresses appetite, which can lead to reduced caloric and fluid intake, contributing to dehydration and a drop in blood pressure, particularly when standing up quickly. That's known as orthostatic hypotension. There's also the possibility of low blood sugar, especially in people taking retatrutide alongside insulin or sulfonylureas. Nausea-related fluid loss can play a role too, and the risk appears to be higher at greater doses and during dose escalation periods. One practical point worth mentioning: if you feel dizzy, avoid driving or operating machinery until it settles. If you're currently participating in a clinical trial involving retatrutide, report any episodes of dizziness to your trial team. You should never stop taking an investigational medicine without guidance from your clinician, even if you're experiencing side effects. More broadly, if you're interested in retatrutide or other medicines in this class, speak to your doctor about whether any current trials or licensed alternatives might be appropriate for you. Your doctor can also review your full medication list to assess whether you might be at higher risk of interactions or side effects like low blood sugar or blood pressure changes. Now, a really important safety point. Most dizziness associated with medicines like this is mild and manageable, but sudden severe dizziness, particularly if it comes alongside facial drooping, weakness in an arm or leg, or difficulty speaking, requires immediate emergency assessment. Please call 999 or get to A&E straight away. These can be signs of a stroke, and that's not something to wait on. So, to recap, retatrutide is an investigational triple receptor agonist not yet approved in the UK. Dizziness has been reported in clinical trials, but it's less common than gastrointestinal side effects. Possible causes include dehydration, blood pressure changes, and low blood sugar. Avoid driving if you feel dizzy, and severe sudden dizziness with neurological symptoms needs emergency attention immediately. This video is for general information only. Please speak to a healthcare professional for advice that's tailored to your own situation. If you found this helpful, let us know in the comments. We'd love to hear your questions. And if you'd like more videos covering medicines, health conditions, and the latest research, give us a like and subscribe to the Bolt Pharmacy channel.